I've opened up a new office that's a very cost-effective office for platelet-rich plasma.
Platelet-rich plasma and peptide treatment. Tell me what that is, what it's used for.
Peptides are small chains or short chains of amino acids,
Mhm.
like glucagon's a peptide, and then the GLP-1 medications are peptides. So peptides are well known right now in the fitness community because there are certain peptides that promote healing. BPC 157 and TB 500. These are the healing peptides. And then there are other peptides that will rev up your growth hormone production.
So they
So
stimulate
they
growth hormone
stimulate.
production.
So instead of receiving exogenous or testosterone or growth hormone, which will lead to a negative feedback loop that'll stop your own growth hormone, you're just revving it up a little bit, you know? And with the GLPs, which are very popular right now for weight loss, I do prescribe those because
Yeah.
weight leads to central obesity, which leads to dysfunctional metabolic health, cardiovascular disease, type 2 diabetes, right? And guess what? It also leads to joint pain. So it's one of the tools in my toolbox. And to make it easy for patients, I'm all about giving people options because I understand that people come from different or they have different resources.
Yeah.
I will provide treatments like PRP. I can do PRP in a very cost-effective way for people because I think people deserve to receive treatment that can help them without breaking the bank.
Yeah, what people don't think about when they think about adipose tissue or fat cells is they think about it's just about the weight of the fat cell. It's not just about the weight of the fat cell, it's about the function of the fat cell. And fat cells are very inflammatory. They produce a molecule called interleukin 6, which increases your inflammation. And we know those individuals that have more of those fat cells are more likely to have inflammatory diseases like cardiovascular disease, like diabetes. So when you use molecules like glucagon, like peptide, GLP, when you use those molecules to basically stimulate your brain to tell you you're not hungry, you're going to lose and shrink the size of that fat cell, which leads to less adipose. And it turns out this molecule is not just helpful for weight loss, it's helpful in cardiovascular disease, chronic kidney disease, Alzheimer's disease, we've seen. So these inflammatory conditions, we can see how helpful molecules like the GLPs have been. And it sounds like in your practice, there are other peptides that can be beneficial for other types of things, like you're using them for supplements or for stimulation of growth hormone, and you've embraced that. Platelet-rich plasma therapy, what is that and what does that do?
Platelet-rich plasma, better known as PRP, is a treatment that will use your own healing potential to heal or promote healing of injuries or decrease the pain associated with degeneration. Now, how is it obtained? Well, it's your own platelets. So PRP, platelet-rich. Why is it rich? Because the platelets are concentrated into a small volume. How is it done? We do a blood draw. We spin it numerous times. There are different methods of obtaining it, and then it's injected into the site with precision, either with an ultrasound for guidance or a fluoroscopy for guidance. And now, after about, I'd say, 20 years of existence, the research is showing that high concentration, not low concentration, but a high concentration injection of good quality platelets can reduce the inflammatory milieu in the joint, so decrease pain. There is a protein in the plasma called alpha-2 macroglobulin that is a protease inhibitor. So it will actually decrease the effect of metalloproteinase, which is an enzyme that will destroy cartilage. It might even be in the lung, maybe. I'm
Yeah,
not sure.
there's different matrix metalloproteinases. Yeah, yeah.
So it's so exciting to know that PRP, which is currently being used for tendon tears and arthritis, it might even have a preventative role for arthritis in the future because of these proteinase inhibitors. So that hasn't been done yet. But I'm super interested in this.
Yeah.
Actually, I've been interested in this. Let's go back to my knee injury, because I have this terrible arthritic knee. It's called post-traumatic arthritis. So I've been a guinea pig. So for the last 15 years, I've been getting all types of injections into my joint. I've had fat injections into my knee, but not actual fat. It's a little different. Also bone marrow injections into my knee and platelet-rich plasma into my knee. So I've been interested in it and I adopted it and embraced it for years.